somebody, the needle, really the sharp needle is for getting through the skin and getting into the vessel. And then what you're going to end up doing is, once you know you're in the blood vessel, you don't want that sharp tip to go through the other side of the blood vessel or anything like that. So the goal is to get the nice cannula over the tip of the needle so that it will not have the opportunity to pierce the vessel in any fashion. So once you get the I can hear voices. Once you get in, you go in at a 20 to 30 degree angle, and once you get blood will flash back up into this flash chamber. And then once you get that flash, you're going to lower your angle of entry to almost to the skin level, and then you're going to go about another 1/4 of an inch. Then you're going to scoop this down over that tip of that needle, and then go all the way to the skin with the hub of your cannula. Then what you're going to end up, then you're going to leave this stylet in until you get everything prepared. Get your tubing hooked to it, because if you take it out, what's going to happen?
Blood.
It's going to bleed everywhere. So you just leave that just sitting there loose like that. It doesn't bleed as much. It may leak around there if their blood pressure is pretty high. But once you get it in all the way, you're going to pop your tourniquet, because your tourniquet, what is your tourniquet for?
Stop
To
it.
make that blood vessel nice and juicy and fat for you. And there are other things that we can do and that's called distending a blood vessel. There are other things we can do to distend a blood vessel. What are they besides use a tourniquet?
Flex the hand down.
We can have the arm lower than the level of the heart. That helps. We can pat the vessel. We can touch the vessel and pat it. Sometimes rubbing it. Okay? So we put it in a lower than the heart. We make sure that the hand is dependent. Dependent can mean two things. It can mean that it's lower than the level of the heart, and it can mean that it's nice and relaxed. Because when people tense up, what happens to their blood vessels? They go deep. They go deep on you. Okay, so you don't want that. Another thing that people don't do sometimes when you have a blood vessel that's not popping up real good for you, somebody's dry or they're just old and they've had a lot of IVs and their blood vessels are not very good, you can put a warm compress on the area that you think you might be able to cannulate, and sometimes that'll make the blood vessels stand up for you. Okay? All right. This is what ends up inside your patient. See how nice and flexible that is? Would that be easier to tolerate than something hard and stiff like that? Okay, good. All right. Now, this has a safety on it. I don't know if the ones you have in your kits have a safety on them, but don't use your safeties for practice, because if you do, you won't be able to use your cannula again to play with and pretend like it's still sterile. This one has a little pump on it where you can just use your finger to push it down into the vessel. Some of them don't. So what part of this could you not touch when you're cannulating a vessel? Anything up in here. You can't touch around here, but you can touch this part. You can't touch down in here because that's going into the person's body. All right? Now, once you get cannulated, when you're using these in real life, you can do that. And see, it just nice, it hides that nice for you. And so you're not at jeopardy of getting stuck with a dirty needle, which is not good. Okay? All right, let's concentrate. You're not in the view of the patient because it makes them nervous when you prime tubing in front of them at times, because you're thumping bubbles and you're doing things like that. So you don't want to be in their presence. Maybe be in the med room somewhere where they're not gonna watch you if you can. Now sometimes you have to do. You've washed your hands, you've checked your IV med against whatever, fluids, whatever, against your doctor's order and against the medics to be sure, just like you would any other medicine you give your patient. Then you're gonna open your tubing. What part of the tubing has to remain sterile?
Part that goes into
Both
the
ends. That's what part has to remain sterile. What's the first thing you do when you open your tubing?
lock
Clamp
it.
it down, because what will you have if you don't clamp it down?
A mess.
A bubble mess. And then you unravel all the spaghetti, holding. Now, if you prefer to have your roller clamp higher on the tubing, it is perfectly all right for you to pull it up the tubing. There is nothing in the world wrong with that. You can pull it up the tubing some so that you can have it wherever you want on the tubing. That is perfectly all right. Now, you can take your, and this can be laid down because it's got a cover on both ends of it. That's perfectly all right. Then you're going to take your fluids and open the bag, and it's okay for it to have a little moisture in there. Then you can lay it down. There's two little teats here, okay? One of them is to put medicines into the bag in, and you can usually tell that it's like a med port here. The other one is to open up so that you can access the tubing into the bag. You can either lay it down or hold it or hang it up, whichever you prefer to do. Now, if it's never been used before, and you're going to have a membrane here that you're going to have to pierce. And so I can throw this away, and I can come up here, and you need to get in there because if you go to the side of it, it's going to be contaminated. Get it up in there, and then you're going to fill your drip chamber a quarter of a way to halfway full. Now, this gives students problems, and you need to be aware of what inverting the med port means. Do you see how it's sitting now, like this, with the cork up? What do you think invert means? You turn it upside down. And I can guarantee you will not do that. It will drive me insane. But I'm not going to be here, so you can do it if you want to. All right. Then, to begin with, now, you will get to where you can do this quickly. But when you first start this, I recommend that you start slowly. You're going to open up your fluids and let them begin to drip. Now, these, used to, you had to take this tip off in order for this to flow because it wouldn't let air come through. Now, these can let air come through, so you can let it drip without taking this cap off, which really makes us safer and not in as much jeopardy of contaminating this end, because this end is critical, because where is it going to go?
Right up against the skin.
Right into the cannula that's in that patient's blood vessel. So we have to keep this uber sterile. All right, here we go. I turn my filter upside down too, so because it gets air bubbles in it. All right, so you're just going to gently, and you have to remember, you're going to open it up, and it's supposed to flow. You open it up, and it starts to flow. You open it up, and it... Oh, whoa. All right, what you're supposed to do is open it up and let it gently start flowing and come through your air filter, and it's supposed to drip about like that. And then you come to this first port and thump all the air bubbles out of there. Why do we not want air bubbles in that port? That med port.
So break loose.
In IV, you don't want air bubbles to go in. In an injection, it's really okay to have an air bubble, but all the air bubbles do, then you follow it all the way down and thump the air bubbles out of here. And you've got to be over a sink or a trash can somewhere. And then you try to get all your air bubbles out. Now, one of the things that you have to be aware of when you're doing this is air flows up. And in order to get the bubbles out of there that you left behind when it wouldn't flow for you, is you have to be sure that you're thumping your air bubbles up, even though the fluid is going down the tubing. So you have to set yourself up, such as I'm doing here, and your fluids have to be flowing to a certain degree to get the air bubbles to go. Now, a tiny little air bubble is not going to hurt your patient. All it will do is attach itself to a hemoglobin and you'll be fine. But a big air bolus or a fairly large air bolus can hurt your patient. It can cause an air embolism. So we do not want to allow anything like that to go into the patient. Teeny little baby bubbles. Now, once you have caused a bunch of fluid to get on the outside of your tubing, you have to distinguish air bubbles from drips on your tubing. Then you go back and check your tubing to be sure you have all your air bubbles out. And then you would label your tubing with the time and the date. And a lot of times in the hospital, they'll have a date and time that it needs to be changed. Also, they'll have a specific tag you put on it. Okay? Then what you're going to do is take your medicine and your tubing and everything into the patient's room that you're going to go to start the IV on. And you take it in there with you along with everything else you might need. Most of the time, if you have an IV start kit, I don't know what y'all's kits have in them, but you've got to have something to clean your wound with. You need to have something to distend the blood vessel with, a tourniquet. You've got to have